We probably have, 30 to 40 randomized controlled trials published every year on exercise and its outcomes. I think in addition to that kind of profound increase in evidence is that there's the recognition that people with MS really want this information.
A lot of research has shown that things like diet and exercise can really impact those symptoms. And so there's been kind of an explosion of learning how these types of interventions or related interventions might work in a person with MS.
If you engage in these lifestyle behaviors very early, you can build up capacities. And those capacities serve as a buffer, some people call it a reserve, against, kind of the declines that will occur as the disease begins to progress. Hi, I'm Robert Motl. I'm professor of the Department of Kinesiology and Nutrition at the University of Illinois in Chicago.
Hi, I'm Kathryn Fitzgerald. I'm an associate professor of neurology and epidemiology at Johns Hopkins.
And I'm Brett Drummond. You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. If there has been one consistent message coming from people living with MS over recent years, it is that they want research performed in areas that can have a direct and immediate impact on their lives. This is not only about being able to improve their quality of life, but also about being able to take control of a disease that is often filled with uncertainty. In this space, there has been no topic that has generated more interest or discussion than lifestyle modifications. But what is the current evidence on how effective they can be at helping to manage disease? My guests in this episode, Kathryn and Robert, are experts in the field of diet and exercise in MS, and we'll be exploring these topics today. Kathryn, Robert, thanks for joining me.
Thanks for having us.
So it really seems that there's been a significant change in mindset around the importance of lifestyle modifications such as diet and exercise in MS over the past 5 to 10 years. In your opinions, working obviously closely in this area, why do you think that is, and how noticeable has it been for you around this change in mindset?
I think it's probably, a lot of different factors, but I think one contributor is just kind of the growth in the body of research related to more of the hidden symptoms of MS, so things like fatigue or problems with your mood or issues sleeping that really do affect your day-to-day life, and that people are also finding out that some of the pharmacologic treatments aren't long-term solutions, or just like in the fatigue case, don't really work much better than a placebo. And so I think outside of MS, a lot of research has shown that things like diet and exercise can really impact those symptoms. And so there's been kind of an explosion of learning how these types of interventions or related interventions might work in a person with MS.
Yeah, I guess my perspective isn't that much different from Kate's. I think what you've seen over the last 20 years is a profound increase in the number of randomized controlled trials of exercise and more recently, diet. And these studies are examining the effects of exercise and diet on a variety of different outcomes, from studying immune cells all the way up through community participation. And I think that rate of science has really accelerated in the last 5 to 10 years, where you probably now have, at least in the area of exercise, Kate could probably talk more about diet than I can for sure. We probably have, 30 to 40 randomized controlled trials published every year on exercise and its outcomes. I think in addition to that kind of profound increase in evidence is that there's the recognition that people with MS really want this information. So the National MS Society in the United States had commissioned kind of this really interesting social learning experiment where they were studying what people with MS were looking for through social media outlets. And they really found this huge interest in wellness. Diet was number one, by far, and exercise was number two behind that. And so the MS Society, really led by Nick LaRocca at the time, has created this wellness initiative that's really turned into an international wellness initiative that I think was really creating lifestyles at a center point in the MS management.
I can speak to that aspect, the wellness initiative from a diet perspective. We've tried to continue this work. It's been probably over 5 years at this time of just trying to expand both the like breadth of diet research in MS, but also kind of trying to reach out and bring in new trainees and younger investigators and scientists and clinicians who are interested in trying to understand how diet could impact MS and trying to provide a platform where we can provide some guidance and things like that.
And I would just say one other thing, Brett, to follow up on Kate's suggestion. I think one of the things that Kate and I both realize is really important to do is figure out how you combine exercise and diet within an intervention, to really see if we can optimize the benefits. We know that they work through very different mechanisms. Diet and nutrition are oftentimes complementary to the effects of exercise. And so I think moving forward, you'll see a lot of interest in these kind of combinatory exercise plus diet interventions.
Yeah, certainly. And I think, you touch on there, talking about some of the mechanisms here. And I guess what I'm interested in exploring next is, we all know that diet and exercise are important. We're talking, at a general population level that these things should be implemented. But what do we understand around the evidence behind this, particularly in the context of MS, in terms of, how are they helping? Or are they helping, I guess, as a first point? And if so, how are they really helping to manage the disease in these individuals?
So the search for mechanisms underlying the benefits of exercise training is really a hot topic right now. People have been studying the effects of exercise on the immune cells that are dysregulated in multiple sclerosis. That really hasn't seemed to be very fruitful as an avenue of research. And part of that is that people in these studies are already on a disease-modifying therapy that is regulating the immune system better. So I think it's going to be hard to show an effect of exercise there. The one area that people have focused on from a kind of biological perspective more so is these neurotrophic factors. These are kind of like these biological agents that help to grow connections between neurons within the central nervous system or support, the growth of new neurons within the central nervous system. That research has been growing. The one challenge with it is that all these molecules are measured in the serum taken from the periphery, and we don't know for sure that they really reflect what's going on in the brain. And so the real kind of focus lately has been towards, using MRI to try to understand, is there effect of exercise on the structure, function, connectivity of cells within the brain itself? That research is really in its kind of early stages. It's growing. There is a lot of focus on it. And I think that we've seen a couple of consistent outcomes. Exercise is improving the volume of the hippocampus and the thalamus. It's improving connectivity between the thalamus and other areas of the brain that are associated with cognitive functions as well as motoric functions. And the kind of overall functionality of the brain seems to be improving with exercise in people with MS. But we need a lot more of that research on mechanisms. And I will say one last potential mechanism that we've been focusing on is looking at changes in vascular function, particularly blood flow regulation to the brain itself using non-invasive technologies where we can basically study the blood flow through the middle cerebral artery to the brain and look at how that's changed with exercise. And the idea being that as you better regulate blood flow to the brain, you're ultimately helping to protect that really important environment from the pulsatile pounding stress of elevated arterial stiffness and things along those lines in MS. So, there's a lot to be done, I guess, is probably the end of the day story.
I think just like kind of to piggyback that Dr. Motl is mentioning is also too that I think that shares kind of a parallel with the exercise is kind of which specific kind of exercise and diet model do you want to study, and like does it translate like from an animal model to like a something that people could adhere to. And so in the diet realm, kind of like focused on, there's like a couple specific diets. So for example, one that's been studied kind of a lot that I know a lot about is kind of a fasting or an intermittent fasting style diet. So basically what happens here is in the mouse form of MS, researchers noted that mice following a fasting style diet, so periods where they restricted the intake of what the mice ate, and then periods of like where they could eat whatever they want or had like more readily accessible food. What they found was that the mice who followed the restricted diet had less inflammatory cells, and then kind of interestingly, like follow-up studies found that in another like related model of MS, which allows you to more closely study remyelination, the fasted mice tended to promote changes in the precursor myelin-producing cells and ultimately improve remyelination. So it's kind of a really like how well that translates into a person isn't really that well known, just especially too, because I can tell from experience, we did a small pilot trial of this type of diet in people, and it's a really hard diet to follow. So the one we did was everyone ate. So for 5 days of the week, everybody ate like a normal diet, 100% of their calorie needs. And then 2 days a week, they ate 25% of their calorie needs, which translates into like not very much food. And so you're pretty hungry most of the time. And so we found that a lot of participants had a hard time adhering to the diet. So whether this is kind of a long-term solution is not, I think it's still an existing question.
No, but I do think it raises an important point around the other things that we can learn through studying things like diet and exercise. And so with fasting, as you mentioned, obviously this potential to promote remyelination has now led to clinical trials looking at a existing medication that can mimic fasting. And so that's being looked at for the same reasons that you talked about, the idea that potentially starting with fasting in people living with MS may not lead to the best results due to inability to adhere to it. But there are a lot of things that we can learn from studying these lifestyle modifications as well. As a sort of side note to that, around understanding the mechanisms, how important do you think that is in terms of getting these adopted more frequently? I know that we have pharmacological interventions that are often brought around where the mechanism of action is unknown. When we're talking about things that are really just adopting healthy lifestyles at their core, do you think it is important that we understand exactly how they're working, or more just, are they working and are they going to provide benefits? Difficult question, but any thoughts on that?
I think just to piggyback right on I think you're referencing the metformin when you're talking about the potential agent, right? So metformin for diabetes, I think they kind of knew what it was doing, but didn't have all the fully mechanisms worked out. So I think both. I mean, it's of course really, really important to understand kind of the mechanism and try to ways that we can potentially like manipulate that to prevent kind of adverse
to minimize side effects, potential adverse events that might happen.
Yeah, like adverse events, but also like making sure we're getting to the right target that we're trying to achieve. But also I think like from a comorbidities perspective, I think this is something we're planning to discuss. Like we know that diet and exercise are super relevant to like other conditions like diabetes or heart disease. And we know that people with MS have a higher risk of getting those diseases and that they're associated with having poor outcomes. And so there's a lot of research that goes into how relevant diet and exercise are for prevention of those concerns.
Yeah, no, I mean, I think it's a really important question. I think as scientists, we're very interested in mechanisms of action, and we really want to understand why what we do matters for the outcomes of interest. I do think that there is a central importance placed on mechanisms from patients from the perspective of if you can tell people with MS that if they engage in a specific diet or a specific type of exercise, and it will do something to the immune cells, or it will help to improve the structure and function of their brain, I think that has some sales value, right? That's part of the reason why I exercise on a regular basis is because I believe the evidence outside of MS and I want to maintain brain health for a long period of time. I think that, and I don't want to step too far into this realm because I'm not a clinician, but I think that clinicians value mechanistic type evidence as well, because then they have a little bit more faith to put into the recommendation that exercise is good for managing a variety of outcomes because they understand the path of action. So I think there is value. I don't think it's the most important thing to getting more people to engage in these behaviors.
No, but I mean, I think you raise a really good point there around it's also about buy-in from healthcare professionals. And, this is something, so we talk a lot to people living with MS, and as mentioned in the introduction, lifestyle modifications is a topic that they're very interested in. But at the same time, they feel like it's a topic that they don't necessarily feel is discussed appropriately in their appointments with healthcare professionals. It's not something that is brought up as something they can be doing to manage their disease. So I guess following on from your answer there, do you feel like this is one of the biggest parts that we can do to help neurologists and other healthcare professionals engage in these conversations with their patients?
We've actually done a series of qualitative studies that were funded by the National MS Society in the United States that has been looking at the healthcare provider as an avenue of delivering exercise promotion in patients with MS. And what we've learned is that people living with multiple sclerosis, they want to hear about exercise. They want the initial conversations about exercise to start with their healthcare provider, particularly the neurologist, because that's the trusted person that really oversees the management of their disease, and it makes a lot of sense. At the same time, we talk to neurologists and ask them about kind of their perceptions of promoting exercise in the context of a patient-provider interaction. And I think that there's a lot of excitement, but I also think that there's a recognition that the time is very small that they have, and they don't have a lot of training in exercise promotion or diet promotion. And so they need some support. And so we're working on kind of some mechanisms or opportunities to help to train healthcare providers, particularly neurologists, to understand the basics of what they need to know. What is a prescription for exercise training? What are the essential outcomes of exercise training? And then providing them with resources to help people kind of go find an environment for which they could go engage in exercise behavior. And I think it's really, like I said, I think it's really an important piece that the neurologist starts the conversation, because I think that will move the impetus behind a person living with MS towards lifestyle behavior change forward in a much more meaningful fashion than me as a neuroscientist and exercise physiologist making the recommendation, to my chagrin.
Kathryn, same with diet. Do you think this is conversations that need to be happening to better engage healthcare professionals as well?
I think so, but with the same kind of limitations that Dr. Motl had mentioned, is just really like timing is a concern. And then also, I think similar to exercise, training and diet and specific healthy behaviors, it's not really a huge component of neurology training because there are a lot of important things. So I think kind of just piggybacking on kind of a similar model in diet of kind of the biggest bang for your buck, kind of, since you have such a limited time, how can we start this conversation and maybe recommend following up with a general practitioner who might have more regular visits and more time to discuss lifestyle and behavior modifications.
And I guess it's about also trying to, you say, with timing and with resources available, trying to communicate this message as clearly and effectively as possible. And I know, Robert, you're involved in putting together some exercise guidelines that I think are now published through the National MS Society in the US that sort of really steps through this. Can you talk a little bit just around what that process was?
Yeah, so the process of creating the guidelines actually started back in 2013 with a collaborative effort that was really supported by the MS Society of Canada. And we had a team of about 20 individuals, researchers, clinicians, people living with multiple sclerosis, read all the relevant research on clinical trials and exercise training. And then we sat in a room for a couple days straight and really hashed out and argued about what we believed were the guidelines for exercise training in MS that really fit the literature for when we saw benefits of exercise training in MS. And so we created these evidence-informed guidelines of aerobic exercise to stress and create adaptations in the cardiovascular system, and musculoskeletal exercises to create adaptations in the musculoskeletal system. And, the recommendations were then updated profoundly through a collaboration with the National MS Society, where we not only reevaluated the guidelines, but we extended them in two very meaningful ways. One was we extended them across the disability spectrum. So initially, the guidelines were really for people who had fairly mild or moderate disease, i.e. people who were still fully ambulatory or might have used like a cane or a stick for walking. And what we did is we extended them through the entire spectrum of the expanded disability status scale score, so that all people had guidelines for appropriate amounts of exercise that should have benefits. The other real novel extension was moving beyond structured, planned aerobic resistance exercise into a guideline for lifestyle physical activity. That is, trying to find opportunities for being more physically active during your everyday life, like, walking around the grocery store. And, some people that we talk to will take a couple extra laps around the grocery store, or instead of taking the elevator, maybe take some stairs. Instead of picking up the phone and calling someone in your office, walking to their office cubicle, but basically trying to accumulate physical activity as part of your daily existence. That was another really profound change in the guidelines. And so now those guidelines can be really easily accessed through the website on the National MS Society for all people with MS, which is the real benefit of that effort.
I guess one of the other things that's sort of been talked about recently, and we've been talking a lot about it in terms of therapeutic interventions, is obviously the earlier we can get people onto an effective therapy, the better their long-term outcomes. Traditionally, there's probably been a bit of a thought around, especially exercise, but probably diet as well, that this sort of comes in as a rehabilitation exercise. Use it when we start to lose mobility. Use it when there are issues that present themselves. But I remember very clearly the sort of mantra that was talked about at the recent ECTRIMS Congress was we need to focus on prehabilitation, not rehabilitation. I guess interested to get both your perspectives from a diet and exercise standpoint on, what are your thoughts around how early these interventions should be being applied? Kathryn, maybe we'll start with you with diet.
I mean, I think this is kind of, I would agree with you that I think this has been applied more in the context of like an exercise field. But I think like the earlier, the better. I think at least from like a cardiometabolic health perspective, like the sooner you adopt kind of like healthier lifestyle and healthy behaviors, kind of like the longer or the more beneficial they become more routine. And that I think that type of framework is highly applicable as an individual ages and moves through their, moves through their like MS trajectory, or how that will change over time.
Yeah, I think, this idea of prehabilitation really comes out of the world of how do you do something beneficial to yourself to prevent you from needing to restore your function once it's lost. And so like oftentimes I think of prehabilitation as something akin to trying to strengthen the leg muscles in downhill skiers so they don't have ACL ruptures and things along those lines. So the thing with MS is I think that you have to engage in lifestyle behaviors as soon as possible after the diagnosis, right? So I think there are a number of things that happen once you're diagnosed. It's get someone on a disease-modifying therapy, get their disease stabilized. But as soon as the medical primary management side of things is stabilized, I think we need to get people engaging in exercise, changing around their diet, and creating these habits very early on that can track over the course of their disease. I think if you do something early on and you develop those good habits, they'll tend to track over time. I think the other side of this is to think about the kind of idea of if you engage in these lifestyle behaviors very early, you can build up capacities. And those capacities serve as a buffer. Some people call it a reserve against, kind of the declines that will occur as the disease begins to progress. So I really think that there's a very important priority to put on exercise, nutrition, diet from as early as utterly possible in the disease diagnosis. Now, that's not to say that if you're 10 years in, it's too late, right? We don't want to give that message. Those individuals who are 10, 15, 20, 25, 30 years into the disease, because we know people are living a lot longer with MS nowadays, they still have the opportunity to engage in exercise and successfully restore lost function, as well as prevent further declines in function, or at least slow further declines in function as they live with this disease for the rest of their lives. Because it's important that we give people self-empowering resources and tools that they can put into place for lifespan benefits.
And I think, we've already seen that with data around lifestyle modifications in terms of smoking, where it's been shown really clearly from data that it doesn't matter how late into your disease you quit, you will see benefits from it. And I think that probably extends to all of these things. I've saved the most difficult question for last, considering the wealth of information that there is on both of these topics. If you each had to give one or two key messages to our audience around this in terms of what they should be communicating to patients, what would they be? Difficult task, I know, but what would those one or two key messages be?
Yeah, sure. I think that my key message, if we're speaking to the patient population in particular, is that today's a great day to start lifestyle behavior change. Today's a day that you can go for a 5-minute walk. Today's a day that you can make a choice of a healthier food option that might involve fruits or vegetables or things along those lines, as opposed to other less healthy things. And starting today, and after you make those small changes, recognizing the power of those changes that you initiated, that you successfully undertook and accomplished, and repeating them the next day. And, we're not asking people, and I get this all the time, to make profound changes where they go from today doing nothing to tomorrow doing 30 minutes of aerobic exercise and 30 minutes of strength training, and then completely eradicating their bad diet and starting a new diet. We're talking about small changes that you can successfully make that over time will build up into a more meaningful and profound change. So my message for people with MS is start today, make a small change and stick with it over time, and you'll be amazed at what happens long term.
I was thinking something like very related, and just that, like, just making like small changes, and it doesn't need to be like, you don't have to change everything. Just like, maybe you don't have to adopt a new diet, but maybe select maybe an apple instead of a bag of chips. So those tiny behaviors. And then I think like once small changes become normal, you can make more additional small changes. So I think they kind of start to snowball as time moves on.
And just encouraging healthcare professionals to engage in those conversations, I guess, to promote those sort of lifestyle changes to people living with MS. We could talk about this forever. There is so much that we could talk about on this topic. I thank you both for joining me today and talking about this with me.
Yeah, thank you for the opportunity to be here. And it's a pleasure to be doing this with Kate, who's really a huge leader in the world of diet and nutrition for MS. So it's a real honor.
Likewise, of course.
And thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode. I'm also co-founder of MStranslate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community. The ECTRIMS podcast is produced and hosted in collaboration with two key partners, MStranslate and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The ECTRIMS podcast is supported by an educational grant from Roche, Alexion AstraZeneca Rare Disease, and other grant providers. Educational grant providers have no input on the podcast series content. You can read more about the topic of this latest podcast episode and more on the ECTRIMS website, ectrims.eu. Do subscribe to the Ectrums podcast on your favourite podcast channels and follow Ectrums on X, formerly Twitter, LinkedIn, Facebook and YouTube.